So we move our tongue for a number of different reasons. We use it to move food around and mix saliva in with our food. You could kind of think of the tongue as a facial expression too, if you stick your tongue out at someone. But these muscles are kind of in their own little group. So these are muscles that move your tongue. Your tongue is actually a muscle itself. It's got a lot of what we would call intrinsic muscle. So muscle that just resides within the tongue. But then you've got what we would call extrinsic muscles, muscles that lie outside the tongue that move the tongue. And we're going to learn three of them. They all have the word glossus in their name. Glossus means tongue. We're also going to learn nerves one day. There's a couple nerves that have that word in their name. First one we're going to look at is called the genioglossus. Now, these are all named after their origins and insertion. So if you're moving the tongue, your insertion must be the tongue. So that's the second half of the word. The first half of the word has something to do with where the origin is. Now, I had to look this up back in the day, but genio refers to this part of your mandible or chin. All right, so that's its origin. Its insertion is in the tongue, or on the tongue, or the bottom of the tongue, and it's going to pull that tongue towards this origin. All right, so if you see the arrows, this muscle can pull down on the tongue and pull the tongue out. So it protracts the tongue if you're sticking your tongue out at someone, but it also depresses the tongue. All right, so it moves it anteriorly and inferiorly. So protraction and depression of the tongue. The next one, the two parts should look very familiar. Stylo refers to the styloid process. So remember that little pointy process that sticks down from the temporal bone? That's right here. That's its origin. Notice the location of the styloid process relative to the tongue. So the styloid process is behind the tongue, it's posterior to the tongue, and superior to the tongue. So it's going to pull the tongue posteriorly, retraction, and up, elevation. So now if you stick your tongue out at someone using your genioglossus, you can pull it back in using your styloglossus. All right, and you can elevate and depress the tongue as well. And then the third one is the hyoglossus. So notice hyo refers to the hyoid bone, which is located right here. Remember your little hyoid bone? It's down here. So the hyoid is below the tongue. So the hyoglossus pulls the tongue down and depresses the tongue. All right, so three muscles moving your tongue, all named based on the origin and insertion. If you analyze those muscles, look at these arrows, they should, hopefully, make a lot of sense as far as what they do. Next group, we're going to talk about some of our respiratory muscles. Now, we've actually got more than these, but these are kind of your major ones. We'll probably add to this list when we get into the respiratory system in A&P2. But respiratory muscles help you breathe. All right, so to better understand these muscles, I'm going to ask you to breathe. All right, hopefully you are. But breathing involves two major steps, right? You got to inhale and you got to exhale. Now, breathing is a little more complicated than that. There's two forms of breathing. There's your normal or quiet breathing. That's what you're doing right now, unless you're on a treadmill, listen to me. But if you're kind of relaxed and resting, we call that normal quiet breathing. All right, and that really only requires two muscles. It requires your external intercostal muscles and your diaphragm. All right, and they contract when you inhale. They relax when you exhale. So everyone take a breath. Now, don't take a deep breath. Take a nice, shallow breath. You inhale. So right now, if you're inhaling, your external intercostals contract and your diaphragm contracts. Now exhale. They relax. All right, so when you exhale, these muscles relax. Now, if we were to start breathing heavily, we call that forced breathing. All right, we're not going to learn all the muscles involved in that. We're going to just learn one of them, the internal intercostals. So they're going to forcefully exhale. So now I want you to blow out as much air as you can. Imagine you're blowing out birthday candles. You're compressing your ribs. You're squeezing your ribs in. That's going to make your chest really small so it can force air out of your lungs. All right? So let's go over them one by one. External intercostals. So what does external mean? Well, it's kind of, more superficial. All right? So the external versus internal has to do with, where they are relative to one another. External intercostals are a little more superficial. The internal intercostals are a little deeper. They're both intercostal because they lie in between or between ribs. All right, so in between each pair of ribs, you've got 2 layers of muscle. You got your externals and your internals. Now notice how they're oriented, completely opposite. So the externals kind of run this way, internals run this way. All right, so whenever you have muscles that kind of are running in an opposite direction, it makes sense that their action is most likely opposite of one another. So the externals are going to elevate the ribs, so they're going to pull these ribs up. And when you pull them up, they kind of move out as well. So when you move your ribs up and out, your chest gets bigger and air enters your lungs. All right, so inhalation. The diaphragm is a flat dome. So it's kind of dome-shaped. And when it contracts, it goes down or flattens. So that also will make your chest larger. So when you inhale, your chest gets bigger. But it gets bigger by pulling the ribs out and up, but also flattening the diaphragm. All right? And then when these 2 muscles relax, the ribs come back down and in. The diaphragm goes back up. Then if you want to force even more air out, you're going to compress your ribs. And that's going to help you forcefully exhale. All right? A couple more pictures, just a little closer view. Notice here we're looking at a nice close view of the intercostals. There's actually another layer, but I didn't tell you about, but we're not going to learn these intercostals here. We just want to learn the externals. Now notice what these are going to do. They're going to pull this rib up and out. All right? Then it's going to relax and it's going to come back in. Then if you want to squeeze it in even further, you're going to squeeze it in using this internal intercostal. And again, notice the orientation. Complete opposite orientation, so complete opposite actions. All right? So those are your respiratory muscles, or at least 3 of them. Next group, we're just going to look at it as a whole group. There's a lot of individual muscles. This is called the erector spinae group. Kind of suggests what it does. To keep your spine erect, that's when you're, straight up, right? When you're really straight up and down, that's, erection of the spine, or extension. So these are acting more on the vertebral column, all right? And this group is a deep group of muscles. So this is kind of weird looking because we've removed a ton of muscles. There's a ton of muscles covering all these guys. So if you remove a bunch of muscles of your back, you're going to see that there's deep muscles. Notice a lot of them are running vertically up and down in the back, and they got all kinds of names. And we're not going to go crazy and learn all these individual groups. We're just learning the entire group as the erector spinae group. All right? And you've got them on both sides. So notice again, this side looks a little different than this side because we've even removed a bunch of them from this side. All right, so let's think about what these do. If you're running vertically and both sides contract, so all of them on this side of the spinal cord or spinal or vertebral column, and all of them on this side contract together, both sides contract, we call that bilateral. It's going to do extension of your spinal column or vertebral column. And that's going to maintain that straight up and down or erect spinal column, vertebral column. If only one side contracts, so let's say just this side contracts, it's going to pull that vertebral column this way. That's called lateral flexion. So that's when you're kind of bending to the side. That's called lateral flexion. All right. So bilateral contraction causes extension, straight up and down. Like if you were tying your shoes and then you stand back up, that's extension. If you're laterally flexing, so you're just bending to the side, that's a unilateral or only one side contraction. All right, so those are the erector spinae muscle groups. All right, now we're going to switch gears, turn around to the front. In the front, we call these abdominal muscles. Abdominal muscles play a lot of different roles. So they're going to move the vertebral column as well. And a lot of these muscles are kind of thought of as antagonistic to the erector spinae muscles. Right? If the erector spinae muscles cause extension, the abdominal muscles cause flexion of your vertebral column, or you could think of it as your trunk or your abdomen. So when you bend over and tie your shoes, right, you're using a lot of your abdominal muscles. Then when you stand back up, you're using your erector spinae group. All right, so the two groups are what we call antagonistic. They're doing opposite things. All right, so let's look at these abdominal muscles. The first one we look at is called the rectus abdominis. So remember what rectus means. It means parallel to the midline. The midline is straight down here, right? That's the middle of your abdominal wall. All right, there's basically a wall here, and there's a number of muscle layers to the abdominal wall. If this is the midline, and this muscle is running parallel, notice the fibers. You can see the muscle fibers running vertically, parallel to the midline. That's called the rectus abdominis. When these little patches almost that are intersected by tendons contract, it flexes. All right, so again, you bend over, tie your shoes, or you do a sit-up. You're doing your rectus abdominis. All right, the muscle is kind of compartmentalized using these tendinous intersections. All right, so this muscle kind of has these multiple little groups or components to it. And you've probably heard of the phrase, you know, your abdominal six-pack. All right, that's your rectus abdominis. What's the difference between this side and this side? Well, over here they cut away all this tendon here. This is this white stuff is all kind of connective tissue in order to see those compartments. All right, what else do we see? Well, we see that there's actually two oblique layers. There's an external layer and then a deeper internal layer. Now on this side, we only see the external layer. All right. And notice how the fibers are running. They're running on an angle or diagonal to the midline. So that's an oblique. Now to see the internal oblique, notice what we had to do. We had to cut away a piece of the external. And that oblique is running the opposite of this oblique. All right, so the oblique layers run on opposite angles. Okay, now here's where it gets a little tricky. And the best way to do it is do this action I'm about to tell you to do and think a little bit. So this, remember, let's orient ourselves. This is the left side of the body. This is the right side of the body. When you rotate to your left, all right, that's what these arrows are going to show, right? If you rotate your trunk to the left, you're going to be using or contracting your right external, all right, and your left internal. And that's going to cause you to rotate to the left. So what that means is the external obliques cause contralateral rotation, whereas the internal oblique causes ipsilateral rotation. So again, when you rotate to the left, you're going to use your right external and your left internal. All right? And that's how you rotate. They're also going to help when you flex. So notice when you flex or again, you do sit-ups or bend over and tie your shoes, you're using all three of these muscles. But you're only using your obliques when you're rotating side to side. All right? The fourth layer is the transversus abdominis. And that one, you'd have to cut away the internal oblique. And notice how the fibers are running. They're running transversely. They're running horizontal. And that muscle really just compresses, kind of tightens your abdominal wall. You do that, you'll do that when you do sit-ups and you flex. You'll also do it when you're exhaling. So these muscles actually function in breathing as well, but we'll worry about that when we get to the respiratory system. All right, so they're all in layers, right? So notice the layering. You got external, you got internal, and transversus. In the front, you really just have this rectus abdominis, but it's kind of the most superficial of the layers, and it's more just in this kind of anterior area, whereas the others are kind of in this more anterolateral portion of the abdominal wall. Now, these muscles also help protect organs. All these different layers offer a lot of protection against anything that might, try to, penetrate through the wall. They're also, again, involved in breathing. These muscles will contract when you vomit. So anytime we want to get something out of the body, sometimes we increase the pressure in the abdomen. So if you're vomiting, or let's say you're defecating, sometimes we'll use abdominal muscles to help force those things out of the body. During childbirth, abdominal muscles will help squeeze down on the uterus and help during delivering of the baby. Notice here we got another muscle. We'll talk more about it because it's not really considered an abdominal muscle. It's going to move your scapula. It's called the serratus anterior. So when we get to these muscles that move your scapula, you might want to refer back to this picture. It's called the serratus anterior because serrated means kind of sawtooth. Notice it's got kind of a sawtooth look to it. And then it's in the front, so it's the serratus anterior. But what this muscle does, it protracts, so it can move that scapula forward. It also rotates it upward. All right, so that's called the serratus anterior. All right, so let's talk about these muscles that move the scapula. We just learned one. It's called the serratus anterior. It's not on this picture because it's in the front, and this is a posterior view. So look at that one on the previous slide. Protraction, superior rotation. We often call this muscle the boxer's muscle because if you think about punching, right? When a boxer throws a punch, they're going to have to not just move their humerus, they're going to move that scapula. They're going to move it forward and it rotates upward. All right? So you should be practicing right now, right? Imagine, put up a picture of me and punch me, right? You're going to be protracting and rotating that scapula upward. Or if you've ever swam, right? If you're a swimmer, you're doing kind of the crawl stroke, you move that scapula up, it rotates, and then forward. And that's what this muscle does, all right? The boxer's muscle or serratus anterior. In the back, we see the trapezius, all right? So remember, we kind of looked at it in the back of the neck, but now we see a bunch of it in the upper back as well. Now, you have to imagine that there's one on this side, too. So if you had one on this side and that side, it would have a trapezoid shape. All right, trapezoids have four sides. It's a four-sided figure. So this one is going to elevate, so that's more this part of the muscle. We'll pull that scapula up, but it also can retract. That's more of this part of the muscle. So we can control different parts of a muscle because every single one of the muscle fibers in this muscle is controlled by an individual neuron, right? So we can, if we just want this part of the muscle to contract, we'll use just the neurons going to these muscle fibers, all right? There's a couple diamond-shaped muscles. These are a little deeper, so they're deep to the trapezius. So that's why we got to remove the trapezius on this side. These are called the rhomboids. Rhomboid means diamond shape. You can kind of see the diamond shape here and here. One's a little bigger, the rhomboid major. One's a little smaller, rhomboid minor. They work together. They help to retract the scapula. So they're going to move that scapula posteriorly, which would be basically opposite of what the serratus anterior does. All right, so now think about what your scapula can do. We can elevate it, we can move them up. Then when that muscle relaxes, it'll go back down, so depression. We can protract it with the serratus anterior. We can retract it with all three of these, all right, and we can rotate it. All right, so a lot of scapular movements are in an effort to increase the range of motion of your humerus. So when you're moving your arm, right, you're quite often also moving your scapula. All right, so if you're kind of moving your arm in a big circle, all right, you can feel that you're not just moving your humerus, you're moving that scapula as well. So scapula helps, again, increase the range of motion we have with our arm. So that said, the next video we're going to focus strictly on that humerus. All right, so we've already learned muscles that move your scapula. We want to think of them as separate, right? We want to focus just on moving the humerus in the next video.